In June 2012, we released a challenge. We launched a challenge to the research community with the objective of helping the development of Ivory Coast. And the idea was, it was a big data challenge. We extracted the network statistics of our operations or mobile network in Ivory Coast, and we anonymized data, package them in a usable format, in very strongly anonymized format, and release it to research community, asking them to find things, anything that could help the development of Ivory Coast, so things about health or transport or whatever. And we've been overwhelmed by the success. So we were hoping for about 40 or 50 research, and we had more than 260 teams asking to get access to the data and proposing projects. So we had, at the end of the project, we had more than 80 submissions of scientific papers with findings and insight in all sorts of directions. We had teams who had collaborate to cross our networks data with data about epidemic of malaria, meningitis, cholera in the country, and try to remodelize the spread of disease so that they could inform the doctors or send the medication and vaccine on the right place. We had teams who had worked on the transportation in Abidjan and across the country so that they could provide recommendations on where to build new roads or put a new bridge or things like that. And then we had also teams who have been working on statistics, for instance the poverty index across the country, inferring the poverty index from the volumes of calls that were going from one antenna to the other antenna. And so that provide new ways to access data that would be otherwise very difficult to get unless you go large cities, expensive, and that you don't only do every 10 years. But there they are almost like readily available. The next step is actually going back in Ivory Coast. So I'm just coming back from Ivory Coast. Last week we had a team, we were the three of us going over there to meet with the authorities. So we met with the Ministry of Transport, the Ministry of Health, the Bureau of the President, and also with the Engineering Bureau, with the National Statistics Bureaus, and so on. And so the idea would be to see how we could build locally the capacity to develop these projects in a responsible and safe way, and to develop new insights that could help the local authorities to decide where to invest their efforts and the funding that they will receive to develop the country. Oh, they were really, like we did, we were completely amazed by the findings, and the same with them. It was very new, just as the concept of big data was new to them, and then being exposed to these findings and seeing maps of their countries, where people live, where people sleep, how they communicate with each other, how a disease is spreading across the country. That was really really extraordinary. And so not only they were enthusiastic, but they were eager to get more. And so we are coming back here and with a list of demand that we hope we'll be able to answer to most of them. So there are different aspects in the question. The first, there are domains where it's necessary to collaborate, and domains where it's not necessary and might increase the complexity. For instance, analyzing the spread of a disease, you don't need to have a collaboration with all the operators. What you need is to have doctors in the field that collect that information and that you have access to that information. But when it comes to informing the local population that they have the risk of a disease, that they need to protect their children with mosquito nets, or that they need to get them vaccinated, so that we'll need to inform as many people as we can. And so of course in that case we will collaborate with all other operators to tell them and to collaborate to say, okay, let's communicate in this region under this antenna to this sort of population which are at risk. So it depends where we need to collaborate, but we will do it definitely where it's necessary. The cost on the Orange side was rather low because we have already data warehouse, we have already teams there, we have already research department who can work on the data. But an open data like this is actually depending on the work of many other teams. Like I said, we had 160 teams looking at the data, which is about 500 PhD and postdoc specialists in network analysis. They have worked. So if you see the amount of work and you monetize that amount of work, that comes to a significant amount. But this was not paid by anyone. It's the valorization of the work put into helping a country. What we want to develop the local capacity, it depends on the level of expertise. There are very sophisticated techniques which have been used and which probably won't be mastered soon or very rapidly in the country. It requires years of practice. So this might be done centrally or in collaboration with universities across the planet. But there is the vast majority of analysis and practical usage of data can be done locally, and that is the objective. For 2015, what I would like is that we can collaborate with the regulators, with the national statistics, with different organizations that would have a say about that, but to define a way that would be safe to create a certain level of what we call data commons, which is a way to share information. Today, it really requires an individual in a company and the courage of a company to do so. It shouldn't be like that. We should find a way to have the right legal framework, the right verification by the authorities, and the right technical procedure to anonymize data so that we can release a certain amount of information in a safe way so that as many people and organizations as possible can benefit of some sort of free data. And if they need to work deeper, then it will be the time to contact the organization who can work on a deeper level. But we should find a way to share better and more information with the general public and the society where we operate.